in these sorts of places. We've lost our visual there.
Can you also just touch the microphone and make sure it's working?
Hello, calling Houston. Can you read me, Houston? Yes, good, right. Okay, so basically, in terms of thinking about long-term care and social care for older people in these sorts of countries, there's very little going on. There's very little societal debate. There's very little debate or concern about this among policymakers. And there is a continual set of claims that, oh, we have lovely families, they look after older people and everything's fine. And there's a lot of evidence, direct and indirect evidence, to show that's increasingly not the case. You always get one or two little state-run programs, with the exception of countries like China, where clearly things have developed very rapidly, providing one or two care homes for older people, and so they can go to international conferences and say, yes, we have an infrastructure of social care for older people, but it's trivial in scale compared to the levels of need. And so you tend to find three things going on. Older people stay in hospital because there's nobody to look after them. Increasingly, you've had a very rapid growth of long-term care sector in low and middle income countries, a new industry, almost all of it on a private for-profit basis, consisting mainly of two things: paid home carers. In some cases, these may be people who've always been looking after young children, cleaning the house, who are taking on new duties, but increasingly you've seen private nursing agencies charging large amounts of money. And secondly, a rapid growth in residential, I just call them care homes. It's very difficult to distinguish between a nursing home and a different kind of care home in these settings. Critically, all of these are almost entirely unregulated by a third-party organization, by the state, and that leads to all kinds of problems. And we're going to be focusing on just some of those problems today. So I'm trying to kind of focus in bit by bit on the main topic of my talk, and I'm mainly going to focus today on the issue of private care homes in Argentina and some of the problems that result from very weak regulation of this rapidly growing sector. So Argentina, which I would take as fairly representative of Latin America. I focus on Argentina for various reasons. There is more information about Argentina, partly information that I've generated myself through my own research. But when I look at other parts of Latin America where there's less information, it pretty much corresponds with what I'm talking about in Argentina. So I'm not putting forward Argentina as a kind of worst example. I think it's fairly representative. In 2010, it was estimated, and we don't really know, that there were at least 6,000 care homes for older people in Argentina. This is not a marginal phenomenon. I would suspect that in 2000, there were less than 1,000 care homes. I've observed with my own eyes, I've been working in Argentina for many years, just telephone directories, internet sites, and walking along the street, the numbers of care homes that have been cropping up. Many of these are unregistered. There was a media expose a couple of years ago that suggested that in the city of Buenos Aires, there were at least 600 unregistered care homes. So that means it's not that they're not regulated, but they don't even get listed anywhere on any, social agencies' lists of care homes. They're essentially illegal, clandestine care homes. And not surprisingly, there are lots of concerns about the quality of care in these homes. And information that's available is almost entirely restricted to newspaper and television exposés. No policy documents, no academic research about these issues. So this is a fairly typical newspaper report about a provincial city in Argentina called Rosario, that just translated for you, talking about very, very poor conditions and claiming that this is pretty representative of the experience of that city. And just looking at that photograph, you get a sense of the overcrowding, the fact that having 4 or more people in a room is much more usual than having just 1 or 2 people in a room. These are often these are just boarding houses. They're squalid, overcrowded hostels where people get dumped. So it's something that I've been concerned about and interested in for many years. I started working in Argentina in 1989. I did a year of field work in 91 for my PhD. So it's a country I know very well. And I've watched this change over time. And I really wanted to get my teeth into it as an academic. And my first opportunity to do this was back in 2005 when I was working with the Pan American Healthcare Organization. And we managed to get a little bit of money and also support from the Ministry of Health that we needed to get to do a survey of care homes in the city of Buenos Aires. And we managed to look at about 100 care homes. We did a number of interviews with people living there, people working there. It has to be said that despite the fact that this was done partly in collaboration with the Ministry of Health, and we had official approval, participation was purely voluntary, and we had a very high refusal rate. We really struggled to get, we were aiming to get 100, and boy, we had to struggle. I think for everyone that we managed to include in our survey, we had 2 or 3 that decided they didn't want to participate, or they withdrew at some point. So, very dodgy research. We didn't deal with those many clandestine, unregistered care homes, of which there are hundreds in Buenos Aires. We talked a bit to residents, but it was always in the presence of managers and staff. And many people didn't want to get involved, and one would assume that the care homes that didn't want to get involved were probably the worst ones. So you would imagine that this would paint an unrealistically positive, rosy picture of how nice life was in these care homes. This survey isn't the main focus of my talk, so I'll just skip through it. But basically, we found actually it was pretty grim. There was a model of care provision which seemed to be sort of something that perhaps had gone out of fashion in Canada and in the UK about 30 or 40 years ago. Very regimented, very little opportunity for older people to take decisions for themselves. High, use of restraints, very high use of sedation, and people were quite open about this. And interestingly, and this is something I'm going to home in on more detail now, many of the people we spoke to, the residents, said that they hadn't chosen to come into care homes. And interestingly, many of them didn't seem to need to be there. So a lot of these old people had very limited care dependency. They could look after themselves completely well. And I was intrigued by the fact that they were in these care homes. What were they doing there? A couple of years ago, and to its credit, the Argentine government carried out a fairly large survey of residential care facilities for older people. And I think this is the only survey of its kind that I've been able to come across in Latin America, and possibly in just about anywhere in the developing world, with the exception of China. So they looked at nearly 2,000 facilities. Again, they excluded the illegal ones because they can't even trace them. Participation again was voluntary, and there was quite a high response bias. This wasn't like some unannounced inspection where you parachute in, your social workers. This was pre-arranged interviews with managers who could tell you what they wanted to tell you, plus a little bit of observation. And in fact, some of the observation was quite revealing. So while you were conducting the interview, there was a checklist of things that you would have a look at. And again, I don't want to go into this in detail, but I think it sets the scene. Just like 43% of care home managers said that residents were not allowed to personalize their rooms. This doesn't mean putting in a new window. This means putting up photographs on the wall. That's what they mean by personalizing rooms. Okay. 17% of bedrooms didn't have a window. More rooms for 3 or more people than single rooms, according to what they say. And these are in the legal care homes. Now, this is going to be the focus of what I'm talking about, and I find this quite striking. Only 17% of care home managers said that they needed any kind of informed consent on the part of older people to come into care homes. And in fact, some of them, when they were asked about informed consent, said, yes, we have informed consent, and it involves a form being signed by myself, the manager, or somebody working in the care home, that we consent to receive the older person. Such was the lack of awareness of this issue. Now, you might say that obviously where you have older people with high levels of cognitive impairment, obtaining informed consent is very problematic, because older people are not in a position to easily provide that for themselves. The large proportion of the population in these care homes did not have cognitive impairment. And 1 in 5 of these care homes said they often admit people who were not care dependent at all. So older people aren't giving their permission to go into care homes, and in some cases, they don't even need to go into care homes. Why are they going into care homes? Something I found quite interesting.
Do not admit, excuse repeat that. So these people only take people who are not dependent?
You got it. Weird. And we're going to sort of unpack this as we go along a bit. Now, shortly before this survey was conducted, and at the same time as this survey was going on, I was also interested in trying to do something that was a bit better than that rather dodgy piece of research I'd done with PAHO in 2015. But of course, it's very difficult. This is a real black box because you're not going to, firstly, you've got to find illegal care homes. Secondly, you're not going to go sort of, from doorstep to doorstep saying, hello, I want to talk to you about how awful your services are. So how do you get around this issue, of response bias? And how can you, sort of get access to this? And this is something I was puzzling about for quite a long time. And in the end, I came up in discussions with some of my long-standing research collaborators in Argentina with something that seemed probably about the best way we could do this, at least to some extent. And that's mainly what I'm going to talk about today. So we came up with this quite customized research design, parts of which are quite controversial, as you will see. We decided firstly that we couldn't look at the whole country. We wanted to provide a very in-depth situated study of just one city because of the complexity of what we were looking at. And it so happened that we had opportunistic reasons for choosing a city called La Plata, which is about 40 miles south of Buenos Aires, a relatively prosperous Argentine city, about 400,000 people. And what we wanted to do was think about all the possible ways we could get a handle on what was going on in that city. So we looked at documents, we talked to local key informants, social workers, health workers, people who had responsibility for long-term care services, NGOs, whoever we could find. Now, we were doing a broad review on the quality of long-term care in the city, so we decided we ought to talk to some communities. We didn't have a large budget, it was only £5,000, but we were able to run a couple of focus groups with older people in two very distinct communities in La Plata, one a fairly poor community, the other one a lower middle class community. And we wanted to talk to them about, to get a sense of their knowledge of long-term care services, their experiences of using long-term care services, and how they try to evaluate the quality of the services that they're using. And additionally, and this is where it gets a little bit more interesting methodologically, we had our secret shoppers, our undercover researchers. There is a tradition of what they call clandestine audit, where undercover research done by academics, not done by dodgy journalists, has been seen as a valid methodology to expose things that otherwise you wouldn't be able to find out about. So, for example, looking at selling. I flagged this one. I gave a version of this talk in Cornell a few weeks ago after some of the horrible incidents that had taken place in the USA. So inappropriate firearm sales. You're hardly going to go into a shop and say, I'm a researcher conducting a survey of blah, blah, blah. Would you sell your firearm to somebody who, it's not going to work. The only way you can obtain information about that is by being sneaky. So there is a track record of this kind of research to deal with difficult issues. It is ethically extremely complex, and I'm going to talk about some of those difficulties. But I think there are 4 criteria which you have to bear in mind when you're doing this kind of research. Of course, you must make sure that it's not exposing the research subjects to harm in any way, and we don't just mean physical harm, we mean in other senses. That this is the only way you can find out what you need to find out. Okay, it's absolutely necessary to get scientifically valid data, not just some media reports that you've come across. That it's stuff that's worth knowing about. There's a significant social value here. And that subsequent to the research, you fess up. You do share your findings with the participants in a way which is useful to them without exposing people and compromising their anonymity, etc. So this is what we tried to do. Oh, sorry, I need to do that later. These were our secret shoppers. La Red Mayor, the Old Age Network in La Plata, which was a pre-existing group of activist researchers who we'd used for other studies in the past. They were mainly middle class, retired, former teachers, former doctor in one case. We were careful to select people who we felt had already got experience of doing research and doing community activism. We felt that was very important. When we got these people together, of course, we had to train them. And this was very interactive. And we kind of worked together because they had an awful lot of things that we could learn from as well. So with local social workers, local gerontologists and other groups, we ran 3 one-day training sessions. We worked together to create the research tools that we used in our clandestine survey, both to benefit from their local knowledge and also to make sure that these were tools that they felt comfortable applying. And they basically did 2 things. They were able to identify care homes that were operating in their neighborhoods, many of which were illegal and unregistered, and they would phone them up. And they would make up a story, a standardized story, always the same story, a vignette. And I'm going to talk about that a little bit further down the line. But basically, it was about a relative, and they were making inquiries about admitting this relative into a long-term care facility. They then, following on from the phone call, went to visit and went to talk to a representative of the care home, and they did some observational research, and they had a list of things they wanted to find out, as well as some more open-ended aspects to the visit. But obviously they wouldn't sit there with their questionnaire filling out the form, and so then they would complete that information, and we would debrief each of them after each visit the same day. We closely supervised what was going on. We also had focus groups at the end of the research process. We bent over backwards to make sure that they were okay and that this met what we had to do to get through our university ethics committee as well, and to get it published. So we put a lot of effort into making this work. So this is what we did. This is our customized design. We started in January last year, doing some kind of scoping work, key informant interviews, looking at any information we could find. We then wanted to find out a little bit more from these focus groups, not the clandestine research, but just groups of other people in different parts of the city, their local knowledge. We thought that would be useful to have that before we started doing other stuff. We then conducted this secret shopper survey. And then, and this is an important phase of the research for us, we started interpreting and sharing those findings. So we had some follow-up meetings, because I wasn't present in Argentina for most of this time, but I was able to have some follow-up meetings with them. We had follow-up meetings with our local key informants to share some of our findings and to deepen the insights they could provide us. We held a public meeting in Town Hall of La Plata, and several hundred people came along to that. We did a lot of media engagement. We were on national TV, local TV, newspapers. And we also did a Delphi, an expert survey of gerontologists and other experts in Argentina and other parts of Latin America, where we shared a summary of our findings in Spanish and Portuguese. And we asked them about the places they knew about to see whether they felt that this was representative in different ways. So a very long process. And now what we're doing is we're starting to engage in terms of trying to change things. And we look like we've just about managed to bring about some legal reform in Argentina. We're also doing a large public education campaign, and we started to work with Human Rights Watch. I'm going to talk about that as well. But for me, going back to this thing, how do we get inside this black box? I know there's nasty stuff going on, but how do we deal with it in a way that's ethical and rigorous as an academic, as a scientist? This is kind of, I think, the best plan we could come up with, and we felt that all of these components were essential. And clearly having a public meeting, which wasn't a shaming and naming meeting of care homes, and we were very careful how we managed that, was part of the way that we shared our findings with some of these care homes. And we are now also working with care homes, and I'll talk about that in a bit as well. Okay. I'll skip that. Now, there's a paper coming out, which I've shared with David, and I'm happy to share with other people. It's coming out in a journal called The Gerontologist in a few months, and it's got lots of detail. I'm just going to share a few bits and pieces from our different kinds of data with you, because I think that works better in a presentation. So this is a testimony. This is one older person, an older woman one of our focus groups. And I think in many ways it was quite typical of the things that we were told in our focus groups. So we were talking to people in town who weren't experts, just older people about their own experiences. So towards the end, we couldn't care for my mother, so we put her in a care home. We couldn't manage because we were both working, and she had a very strong character. She was a very active person, but she couldn't get out to run errands. She could still walk around the house, but she needed someone with her all the time. Sigh. She adapted to the care home because it's a good one. She was only there a short time before she died. What do you make of this narrative? If you were doing, and some of you, I know as students, and some of you are professional academics, what would you, obviously I've highlighted some bits in red. What do you make of that narrative? Well, I just have a drink of water and get my voice back. Is that the kind of story you get if you talk to people in Toronto, do you think? Is this a fairly universal kind of narrative of putting somebody in a care home? Yep. And do you see any grounds for concern emerging from this narrative? Yeah, and they certainly have mother-in-law issues in Latin America, believe me. That's true. I mean, yeah, sorry? Yeah, that's the point I'm making in the paper. In every single, and in the expert interviews as well, everybody talks about an older person being put in. There's no agency there at all in the language, let alone in anything else. So yeah, you wonder what the motives were here as well. This was a person who didn't seem to need a lot of care. They needed a bit of company. And she used to go out and run errands. Now she can't do that. Well, it's not much use to us. It's, and this was very important, that when we spoke to people in focus groups, typically they would say, yeah, all the care homes in the city are terrible, awful, apart from the one that I found for my mother, which is fine. Oh, I was so happy I found this really good care home. Okay, she died a couple of months after she went in, despite having been a very active person before she went in. But you get quite interesting accounts from these individuals, which I think begin to raise some interesting questions. Presenting qualitative data in a short talk is always very difficult. So this just gives you a little sense of what we found. Clandestine audit, we managed to do 30 care homes in La Plata. We think there are about 60 or so care homes operating in that city. We can't say for sure because some of them are completely illegal. So we covered about half of them. And this was the story that they told when they phoned up. It's a little bit more complicated, but I'm looking for somewhere to look after my sister. She has some problems with her behavior and can't manage things for herself at home. Now, we intentionally were vague about this. We didn't want to say she can't actually decide anything for herself. We think she might be developing something like dementia. And she can't manage things for herself at home. Does that mean she can't cook a 6-course meal for the Queen? Or that, she can't do anything for herself? So we left that very open intentionally. And what we found from the phone calls, from the visits, is that with the exception of 2, they didn't want to accept somebody with high dependency. So this was the finding we saw in these other surveys. You just need a family signature. We just need to be able to see you can pay, because they're all private. We'd like to look at the medical history to make sure they're not highly dependent. Y basta una firma de la familia. We just need somebody to sign off from the family. Only, actually, that's a lie. No meeting with older person. One care home wanted to meet the older person before admission, and that was to find out whether they were a troublemaker. And there was no notion of the older person having a say in this process. No interest in that at all. Now, as I said, we also spoke to social workers, health professionals, and we did 10 interviews. And I think across those 10 interviews, in about 5 of those interviews, we had at least one story that was told to us, in some cases more than one story, about very coercive admission of older people into care homes by family members. So this is just one quite typical example. We had a case who was diabetic and obese and was living in her own house with a carer quite happily until her grandson got married. The girlfriend got pregnant, well, probably not on her own. And what did the family decide to do? Go and live at grandma's house, shove her into a care home, and not even visit her at weekends. She died a few days ago because she'd gone into such a grim place, locked up. I can't imagine what conditions they kept her in. That's fairly typical. Here's another one. I could give you lots, but just to give you a sense. Last week, I had to get involved in a case where the daughter had changed the locks. We sent her, this was a social worker. We sent a report to the family court so that they could intervene. Once we do that, it's out of our hands. The lady concerned was placed in the care home since she'd previously been in a hospital bed, but was completely healthy. She just didn't have anywhere to go back to, and her daughter kept the house. Again, this is a study with many limitations. Firstly, we weren't able to talk to people in care homes. Secondly, even though we did a clandestine piece of research, I feel that there was still a positive bias. Firstly, of course, these care home managers were talking to people who were potential clients. They were hardly going to say, it's awful in here. Don't send your sister to this care home. So, and moreover, when we did some of our follow-up discussions, this was the kind of comment that we got, so this is one of our secret shoppers reporting to me saying, I think they knew that something was up, and they were very careful what they were saying to us. And of course, we only looked at 30 care homes. It was about half the care homes in this city, but it's a very small data set. But I think at least it provides enough of a sense that this this needs to be looked at more carefully. So how on earth is this all taking place? And in fact, we had a meeting in New York City about a year ago, didn't we, where we were talking about financial abuse, and we talked about, we came up with this word, some of you might know the word abusogenic environments that encourage people to behave in ways that lead to obesity. And I think that in some senses, you could see that Argentina and other countries like Argentina are a highly abusogenic setting. There's a context that's driving this. Firstly, long-term care services in Argentina are public services are very weakly developed. And if you are a family carer of an older person in Argentina, you get no support from social workers, from nurses, from health visitors. You are on your own. So you either take on that full burden of care or you put that person into a residential home. It's an all or nothing kind of predicament that you face. At the same time, those homes, which are largely privately run, are, even the ones that are official, are not regulated. I've got a separate paper, which I'm not talking about today, which shows how non-existent the regulatory structures are in this particular city. So, of course, that creates opportunities for them to behave in these sorts of ways. Second set of context is about intergenerational dynamics and about law in Argentina. In the whole of Latin America and in some other parts of the world, I don't think in Canada they have a Napoleonic legal code. If you've got an older couple who own a house, when one of them dies, probably the man, leaves an older widow, she only owns half of that property. The property is immediately, half of the value of the property is immediately passed on to the children. That places that person, usually an older woman, in quite a vulnerable position to the family trying to usurp ownership of that property. And being able to show that that person isn't able to look after themselves and get them out of the house into a care home is a very good way of being able to obtain that very valuable asset. In Argentina, the country was relatively prosperous 40 years ago, and it had quite generous state housing programs. So a lot of older people were able to get hold of housing. The last 30 years haven't been very kind on Argentina as an economy. Most younger people have really struggled to get on the property ladder. I look at these older people who've got subsidized housing from the state. They're living in very overcrowded conditions. So you can see how this is driving a situation whereby people perhaps feel that this is the only way they can get access to a home of their own. And more broadly, clearly, there is a tremendous element of denial within society, among policymakers, to address this issue that's going on, which I'm going to talk about in a minute. So I want to go back to one of our key informants, because I think this really reflects what I'm saying about this context. These days, people don't even view this practice as abusive, coercively nudging older people into care. Problem is that it's completely legal. The older person doesn't see it as an infringement of their rights. They just see it as a natural part of being old. The situation has come to be seen as normal. You get old, the children need a place of their own, So you just sell your house and go into a care home, or in some cases you don't sell your house and you're pushed into a care home. So you can see how this is encouraged by the wider context. And this is a wider context that I don't think is unique to the city we were working in. Of course, this is Argentina. Thank heavens we live in the UK or Canada where nothing like this could ever possibly happen. I was required by the journal I was publishing this in to do a deeper review of the literature on admissions into care homes in high-income countries and similar concerns. There's no literature on it at all. There are a couple of papers that came out about 30 years ago, not very strong papers, using the term, which I don't like, granny dumping, but there you go. Other than that, all the academic studies of this are extremely sympathetic to families dealing with the stress and trauma and sense of guilt that they often feel relating to putting an older relative into care. And I understand that and I sympathize with that myself. But I wonder if the baby's been thrown out with the bathwater a bit here. We need to think about some of those rather less altruistic motivations placing an older person into care. We know that elder abuse, financial elder abuse, and of course here we can see there's a link with financial abuse, is widespread. I'm happy to talk about that, but there seems to be very little talk going on about these sorts of problems in countries like Canada. As it happened, I was in Canada. I arrived yesterday, I just got off the Greyhound, but I had a day in Canada in transit to somewhere else in the summer. And I got a free local newspaper in my hotel, and I found this. I'm sure, does the hyperlink work? Please work. That's really annoying. It would work on my PowerPoint, but it won't work on yours.
No, because it's copied.
Well, anyway, it was a newspaper report that basically said that you have quite a lot of care homes which are not very regulated in Toronto, and it was just going on about that, and there's real concerns about some of the abuses that may go on. So that's okay, don't worry.
Oh, yeah,
so it's in thestar.com. Unlicensed group home operators face new health and safety violations, blah, blah, blah. So the point I'm trying to make, blew up in my face, was that clearly we mustn't feel complacent, and we mustn't other the experiences of places like Argentina, and either in a kind of judging way and also feel that we're completely unlikely to experience those sorts of issues. How do I reduce? Oh, it's here, isn't it? Yeah. So what are we doing? Well, we're trying to, one of the things is they brought out lots of regulations, thank you, about how older people should be treated in care homes, none of which are respected at all, and people just pay bribes to the police and are allowed to continue doing what they're doing. But on paper, they have lots of regulations about respecting older people and making sure they're well looked after when they're in social care in Argentina and other parts of Latin America. But what they don't do is talk about the process of the person being admitted. It just focuses on the responsibilities once they're in the care home. They also talk about the responsibilities of family carers in domiciliary settings, but they don't talk about this little bit when the older person is forced into care against their will. So one of the things we've been able to do is to, it's now actually taking place, is to change national law in Argentina to say that this will be required. I don't think it's going to make a shred of difference. Might make a bit of difference. It'll get reported in the newspapers because people don't necessarily have to follow national law, but at least it's something.
Sorry, say again, what is the new law?
The new law is that care homes will have to have documentation to show that the older person has given their informed consent to be admitted into the care home, or that a surrogate decision maker, and that there are, there's due process for saying that this older person isn't in a position to make that decision for themselves. So you would apply deprivation of liberty kind of legislation then. Yeah, but we're not going to do it. But it's a start. What I actually think is more important than changing the law is raising awareness of this. There is still this reluctance to engage with the issue at all levels in Argentina, and this discourse that care homes don't exist and that families look after older people. So we've been engaging a lot with the media and with NGOs to try and raise awareness of these issues in a number of different ways. This is a bit dodgy, but anyway, one of the things we've learned working in Argentina is that Argentines, I know the country very well, I've lived there several years, are very sensitive about human rights discourse, given the history of that country. And so framing this, as one should, as a human rights issue, has particular salience in Argentina. This is a quote from a book that most people in Argentina were required to read when they were in school, which is The Gulag Archipelago by Alexander Solzhenitsyn, which was a very famous book about all the human rights abuses that took place in the former Soviet Union, when it was the Soviet Union. And there are a lot of nice quotations from that book, which talk about an underground network of places where people who didn't fit into society were dumped and treated very badly. Everybody knew they were there. Nobody wanted to talk about them. This was, as Al Gore would say, an inconvenient truth. And we're using that language. This was a quote of his, our sewage disposal system, getting rid of the social and the political, people who are seen as deviant in these places. And I think there's some real power. So we're quite shamelessly using a quite strong human rights discourse in Argentina. And this is annoying people. This is leading to controversy. Some people saying, how dare a British person come to talk to us about human rights after you invaded the Falkland Islands, all of that. But at least it's getting people to talk about it. And another thing that we're working strongly on is trying to promote what I call care literacy. Now, one of the things I found quite surprising, and this is a term I'm promoting quite a lot, what I mean by care literacy is we talk about health literacy in some cases. Care literacy means understanding what goes on when a person gets older, what frailty means, how you deal with incontinence, blah, blah, blah. At the same time, knowing where to get help if you need it, and being able to evaluate whether the help you're getting is good or not. So it's quite a broad concept. And I think fundamentally in Argentina, there's very limited care literacy. There is in all countries, but particularly in Argentina. I don't think we're going to be able to make any positive change unless we're able to engage with that. Interestingly, in the two focus groups we worked in, there was more, in general terms, care literacy in the poorer neighborhood than in the richer neighborhood. That's because they'd worked in care homes and they'd worked as paid carers for older people. And that rather nice self-justifying discourse around, yes, but I put my mother in a good care home. You couldn't get away with that in that focus group because people said, oh yeah, of course it was, and they would laugh. So there was much more awareness of the grim reality among that group. And we're also developing a community intervention. I don't know if I've got a slide on it here, which is, we're about to go live with a social media platform, working with that group of older people, clandestine researchers, local human rights group, and some other local organizations. We set up a kind of TripAdvisor, local TripAdvisor web platform where only care homes that sign up to certain standards of quality will be allowed to put information about themselves on this local website, which will be run by these local organizations. And where we get complaints, they don't go up immediately like in TripAdvisor, but they are then reviewed by the local organization that we're managing this. And if they're held up to be problematic and they don't improve, they will be taken off. So that's something we're doing at the moment, and we're hoping to scale up elsewhere in Latin America. The trouble is the capacity of the state to do stuff is extremely limited. And I think both to develop care literacy and to actually increase the accountability locally of care providers, and also information. People don't have any information about where care services are. It's all by word of mouth. You need to have these kinds of grassroots, bottom-up interventions. So I'd love to take what we did in this one small city and extend it. And we're trying to do that a little bit. It's difficult because we were very lucky. I've known that city for many years. One of the people who works in that city was on the board of directors of Help Age International, which is a large NGO. We were able to find a group of people who were not politically compromised. It's extremely hard in most of Latin America to find groups that don't have some kind of political allegiance of one kind or another, which makes it very difficult to use them as objective gatekeepers and objective researchers. You couldn't do this in the other countries because governments wouldn't let you do it, and you get into a lot of trouble, which would pose danger to researchers. One of our Delphi experts from elsewhere in Latin America, from Colombia, said, boy, if you did this in Colombia, you'd get your legs blown off, as a researcher, this would not be allowed to happen. I had a meeting in Human Rights Watch about a month ago, and they said, oh yeah, we'd like to apply this design. We're trying to get some money for it, although apparently Human Rights Watch don't do anything unless they can get £500,000 in funding first. They charge a lot of money for their work. But anyway, we did this for 5,000. But they said, we might do this in Brazil. Our Brazilian partner's very interested in it. And I said, well, okay, well, you have to think about, going through your ethics review and all of this, because this is tricky stuff. Said, oh, we're Human Rights Watch. We're not an academic organization. We don't need ethical approval. We can just go off and do this stuff. Would you like to collaborate with us? Which poses a bit of an ethical dilemma for me as an academic. Do I collaborate with an organization that doesn't have to use ethical whatevers? I mean, I like Human Rights Watch as an organization, but still. That's it. And I don't know why I put this slide up, really. It's not very user-friendly. People like to do that, though, don't they? And that's my email. And I've got a few cards. Thank you.